Hi, everybody. For most of you, I think you know, I'm Stacy from Occupational Therapy.
And I'm Kim, I'm from physical therapy.
Okay. We are going to try to double team the presentation since a lot of times we do talk about the same things. Yes, we might go about them a little differently and focus in on different areas, but we're usually overlapping in what we talk to you guys about. Okay. So if you have questions as we go along, just feel free to raise your hand and ask as we go. First thing is we wanted to clarify the differences between OT and PT. So a lot of times when you come to us with clinic or in the research setting, we hear a lot that like one person's doing both things, OT and PT. Sometimes okay, but a lot of times we like to separate ourselves. So OT should be focusing on the activities of daily living or the instrumental activities of daily living. So we refer to them as the ADLs or the IADLs. So ADLs are the basics, dressing, feeding. The IADLs are things like certain activities or clubs that your kids might be, trying to be interested in or something of that nature. For the ADLs, we're looking at even the basic things of like, when you dress your child, is it easy? Can you like get their legs open to do a diaper change or to put clothes on? Is there a way you found at home that they can do a certain like toy or game and you need our help to maybe adapt that so that they can do it when they're playing with other children or something? So, we're open to all ideas and you know your child the best. So please let us know if you're seeing something that we're not and how we can help you get there or get it more frequently. For physical therapy, Kim likes to focus on the gross motor skills. You want to talk about that?
Yeah, so as far as PT goes, for gross motor skills, we're looking at kind of how you move your body from one place to another. So crawling, sitting, walking, running, all of those kinds of big full body activities.
Okay, so specifically with occupational therapy, some of the general areas that we'll look at, vision, tone management, positioning, splints and braces. So for the most part, that's both of us, except for maybe the vision piece, like I look at that a little bit more closely. When we're talking about vision, I, again, want to see, like, what do you think your child's seeing? Is there certain ways we can adapt the environment to make them successful? Certain colors they like? Do they always like to look to the right? Are they always looking up? Because those kind of things can also determine maybe how they're sitting. Are they always kind of slouching down in their chair with the head down? But it's because they're trying to look up in their eyes. That's maybe the one thing that they're controlling. And then I can help make recommendations if there's other specialties that could help more than me. Tone management things that we look at is, trunk weakness. Is there bracing that we can suggest or certain positioning in their chair that we're going to talk about a little bit more specifically that we can help make them successful and have a nice position when they're in their chairs because they spend a lot of their time in the chair. I know a lot of you, we've talked about like the dynamic trunk orthosis. So that would be the Spio or a Benic or even the Dragonfly, which is a comfortable, soft brace that they can wear. Some of your children may be able to wear outside of their chair to help them, or even if they're sitting maybe at school in a different chair, to help give them a little bit more trunk support and head support. The take-home message that we want to give you right now for today with that is, if you're not supporting your core, it's going to be harder for them to hold their heads up, which everyone was always talking to us about, and also even to use their arms. So to try to reach for that toy or grab something, if they're working so hard to keep their trunk and head up, then that's going to be really, really hard for them. Splints and braces. So common ones that we refer to in OT is a resting hand splint, a dorsal cock-up, elbow extension splints, thumb abduction splints, and then a supinator strap. It's to help to flip the hand. We're going to talk about that in a little bit more detail, but just to get you familiar again with those terms. And Kim will talk about the PT braces.
Yeah, so as far as PT braces, we're looking at things like AFOs to hold their position at their ankles. Those can be the night splints are more of a dynamic form of that versus the static ones that are typically used for some of their activities like standing or just maintaining their position throughout the day. And then there's different kinds like shore steps, which are a little bit smaller. And then like Stacy mentioned, some of those more dynamic trunk braces that we can offer.
Okay. And then just another quick review when we talk about the different therapies. So school therapy should be focusing on school-based activities. So things that the school can do to make your child successful in school, in the learning environment. They shouldn't be focusing on home activities. That's when we talk a lot about outpatient therapy. So your outpatient therapist should be focusing on strengthening a lot of time and then home-based goals. So that's when they'll do a little bit more of the fine motor stuff or bilateral coordination for OT. And it's things that you should have as goals when you go to that therapy appointment. So we love videos or we love ideas of what you're trying to accomplish, because in outpatient therapy, we really do try to push episodes of care. So it's seeing the outpatient therapist, for 6 weeks or 12 weeks, focusing in on a couple goals and then taking a break and then coming back and trying again, maybe with something different or to build on that or try it again because it didn't work the first time. Other things that a lot of you have talked about is like aquatic therapy, hippotherapy, and the vision therapy if it's relevant for your child. Okay. So for OT, the common splints that I'm just going to briefly talk about, more to help you understand what the purpose is most of the time. Every patient and child is different, so I can't say that yes, your child should definitely have this. It just depends on what our goals are for that patient. So resting hand splint, the purpose is to maintain the wrist in neutral alignment, so straight. Sometimes a resting hand splint can also help promote wrist extension. We also talk differently about a static splint, so that's just something that's holding the hand in a certain position that we picked, versus a splint that's progressing. So we're trying to progress, so gain extension, okay? Most of the time, the resting hand splint is recommended just to help maintain for comfort and overall positioning. But like I said, once in a while, we will use a resting hand splint to help progress and maybe get a little bit more wrist extension or get those fingers out a little bit straighter. The dorsal cock-up splint, I feel like this is the one I explain the most. So the purpose of that's the center one is the dorsal cock-up. The first one, I'm sorry, I didn't point out. Oh, I think there's a pointer. Here you go. This one is the resting hand splint. This is one of my favorites that I tend to recommend. So for you guys who come to clinic with us, it's called the comfy splint. Oh, I'm in no way affiliated with anyone. This is just what I really like. The comfy splint, I really like that when you're looking for just comfort, keeping that hand open, keeping it in a nice position. If we have to give them a little bit more flexion, we can do that. So bending of the wrist, we can do that. But it just keeps the hand open and the thumb space open there. Very comfortable, usually a big hit. This is the dorsal cock-up. The dorsal cock-up is just holding the wrist up so that they can move the fingers, but it would help with grabbing things, so grabbing blocks or toys or anything of that nature. When your wrist is bent, your fingers are open most of the time, okay? It's just the way the muscles in our hands work. As you bring the wrist up, it's easier to bend them. So it's very hard to bend your fingers with your wrist down. So positioning in that sense is very hard, very important, I mean. And then last is a thumb abduction, which is this one right here, which is to put the thumb in a better place again for grabbing. So if you think about it, when you go to grab, anything off the table, you don't have your thumb out in that L shape, you have it more in. And so that's what this splint does, is brings it in a little bit for you so that they can be more successful when they're trying to grab. Okay? Any questions so far? Good.
So talking a little bit more about some of the PT equipment, obviously transporting our children is incredibly important. So here's kind of two different options. We have the standard wheelchair that everybody knows about, and then a medical stroller. A lot of people like the medical strollers because you can fold them up and put them in your car, which is a little bit harder with the wheelchair. The big important thing with either of these pieces of equipment is positioning. So a lot of our kids, a common theme with them is that they have their core is very hypotonic or weak. So what can happen is because they're so weak, then it can start to affect their spine over time and not keep them in a very nice, straight, upright position that we like. So getting all of these additional supports, like the head support and the lateral trunk supports and things, are really important, and important that they're placed in the proper way to maintain that really nice and neutral spine, because these are kind of probably some of the places that our children are spending most of the time. So if we can keep them in that optimal position and maintain their spine in that really nice alignment, it's going to affect a lot of things down the road, like respiratory function and other things. So positioning in these pieces of equipment is super important, which is why we also encourage that all these pieces of equipment, for the most part, have a hard back. So sometimes a lot of people try to go really long with like those umbrella strollers and things because they're super easy to throw in their car and they're easy to bring around, but they don't provide that like optimal positioning to provide that really nice spinal alignment for our children because the back is so soft. So when we're looking more at moving or walking, so these are some things that typically we go to, which are gait trainers or rolling walkers. So how I have them placed here, they kind of go in order of support that you get given. So the gait trainer down here on the left, which is a Rifting gait trainer, which is something really common that we use, can provide literally support everywhere depending on what you want. It can provide arm support, trunk support, seats, supports at the legs to keep their hips apart if they have a lot of tone and their legs are coming together and crossing. The only thing that these things don't provide are head support. So, looking into that depending on whether or not you're putting your child in these. But they're really just a good opportunity to get your child upright, to give them a chance to try and move their legs or take some steps or feel like they're mobile. And then as you go, if depending on how well they're doing, you can go to something a little less supportive, like some of these posterior rolling walkers that will give them some balance, something to hold on to, but something, again, to continue working for their gait. I think positioning is really important, similar to all the things we've talked about in the spine. It goes with every other part of your body that you need to have really nice alignment to be as successful as you want to be. So we want to be able to provide our children with good alignment at their joints if they're trying really hard to work. So starting on the left, this is some of the bracing that we look at. The first picture over here, these are all like our static braces, the things that we typically recommend for kids to be wearing during the day or when they're trying to do a certain activity, like standing in a stander or going in a gait trainer, or even sitting in their chair for going to school while they're in their wheelchair. They're going to maintain this nice neutral position. The neutral position at the ankle is really important because if they're not neutral, then it affects their ability to participate in standers and other pieces of equipment. Even sometimes sitting in your wheelchair can be really hard if your ankles are pushed down because then they're pushing on the foot plates and then you can get skin breakdown and other things. So a neutral position at the ankle is super important. So when it's not during the day and they're in the static brace, you can look at some of these more dynamic braces. So this is what we would consider like a static progressive brace in the sense that it holds a static position, but you can advance that position as you go. These are called night stretching splints, but what I like to reinforce to every family is they don't have to be worn at night. If your child doesn't sleep well with something on them, then don't put it on them at night, but you can put it on as long as they're not trying to stand up or be in a stander or do anything like that. As long as they're pretty static sitting in a chair, then this is an okay thing that gets to be worn. What you do is you can put them in it with their toes flexed down, and then you pull on these straps to pull them up to where they tolerate that stretch. And then you kind of lock them in place so that they're getting a really nice stretch the whole time that they're in this brace. The great thing about this is that the best way to stretch a child is low load, long duration stretching, meaning it's kind of a light stretch, but it's happening for a really long period of time. It's not possible for any of you to sit around and stretch them for an hour, 2 hours. You can't. So the brace will do it for you. This is more of a dynamic brace, so in the sense that it's constantly going to be providing a stretch. So if you put them in it, this is good for kids who have a lot of tone, because if you put them in this and they have a lot of tone, and then as they relax in that brace, the brace will move with them to where their limit is, and you'll be able to get a really, really nice stretch from it. Down here, as far as positioning, I have two different types of standers. There's a supine stander, which is more supportive. You have head support and other things. But if your child has head control or upper trunk control, then the prone stander is really good. Weight bearing is a huge thing for all of these children. It's how we get our bones stronger. It's how we maintain our hip stability, which is really important for all the kids who have a lot of tone. They can, that tone can actually pull their hip joints slightly out of socket. So we really want to maintain hip stability and bone strength, and that's what this is going to do, because they can stay in this for a really long time, as opposed to like a gait trainer, which they may only tolerate for a few minutes at a time because they have to work so hard. They don't have to do any work here. and it's going to provide them all of that weight bearing that they need to maintain all of those things. And lastly, just talking about how we get some of this medical equipment. This may be different depending on where you live and what resources are available to you. We always recommend that you find something that's called a seating or an adaptive equipment clinic, because a lot of children have need for more than one piece of equipment. So what these clinics will do, they'll have a vendor who is a person that is from the equipment company, and they know all of the equipment backwards, forwards, and inside out. And then also in that appointment, they will usually have a therapist, either an OT or a PT, who's going to be in charge of deciding the proper positioning in all of this equipment and maybe some ideas of equipment that that child might need that maybe a parent hasn't thought of. And they'll work together to decide every piece of equipment that they think that you need and order them all at one time versus having to try and kind of piecemeal it with your therapist, ordering one thing here, one thing there. And then lastly, unfortunately, a lot of insurance companies will almost inevitably deny every piece of equipment that you try and get, at least the first time that you try and get it. It's just kind of how it is, or at least here in the United States, that's how it is. So the clinic is responsible for handling all of those denials and going back and appealing that process for you so you don't have to do that work. In case you live close to us, this is the phone number for our adaptive and seating clinic that you can call and make an appointment for. So those would be the people in charge of getting wheelchairs and positioning chairs, standers, those gait trainers, those kinds of things. But the orthotist is going to be the individual who's going to be in charge of any lower extremity orthotics, hand splints that are more custom, the dynamic trunk braces that we've talked about. So an orthotist is the person, you can Google them depending on where you live and what's in your area. And they'll be the ones who will fit your children for all of these pieces of equipment. And any equipment you need, obviously, typically, at least from the United States, if you're going through insurance, will require a script from a doctor. I think that's it.
Yes. Questions?
Anything? No?
I think the one other thing, like we, again, just want to really stress is if you come to an OT or PT appointment or clinic, if you come to OT, PT or the clinic appointment, bring your braces, bring your splints, bring everything. Even if your child's not wearing them, bring them. Because it's better for us to see what didn't work last time so that we don't make the same mistake again or we can understand where the problem is. But if you don't show us anything, then it's really hard.